Research has always been done to us.
And I think that's why there's such a mistrust.
Whenever we hear words like research, we freeze.
A lot of my family has no idea. We just know that we die young.
There is a drug, but it's not been well studied in minorities.
It's very hard to find a test for this cholesterol level out in the community.
If we're going to create awareness around this, how do we do that?
My name is PTA Jackson Booth. I'm an internal medicine physician. And really what attracted me to Care Access was to be able to reach more people. The idea of Future of Medicine is partnering with communities to provide many blood tests, some education, and direct people to where they can find out facts about their own health that will help them later on.
I have cardiovascular issues.
I have strange cholesterol levels.
My family has a history of heart problems.
People start having life events like heart attacks and strokes and things like that. You want to get to the bottom of why the people in the community are having those events.
When I learned about the importance of testing for LPA, I decided to come out and get tested.
My sister, she was doing great. She had a heart attack. And then I had a stroke, even though I thought I was super healthy.
My son lost his wife 2 years ago. She had breast cancer. You hear people dying from illness that could have been prevented. We're trying to get people to change their habits and try to take away somebody's pain.
Part of the mission of Care Access is being able to reach people who are underrepresented. It's really critical partnering with the community. We just can't swoop in without them knowing who we are.
First, when I got the call, she goes, "Hi dear, are you interested?" I go, "You're an answered prayer." There are many barriers to healthcare, so the presence of Care Access here is really critical for this community because it's really coming to where people are at and meeting them where they're at in a comfortable environment, in a place that they know.
As we learn more about the community partners that we engage with, we learn more about the community in which we serve.
This is where we come in, especially black men. We come in, we discuss. Oftentimes there are conversations going on about health.
A lot of us are going through some of the same kind of issues. You feel safe here.
What I told a lot of the people that came in today was like, hey, sometimes you just have to, get out your box and try something different.
It's super important that Black people, especially at HBCUs, are given the opportunity to even have these screenings.
Care Access was getting out and immersing themselves in the community. It really felt like a genuine care and concern, not just for our students, but for our institution.
We can still feel it. All those wrongs.
Yeah.
It's just always there. And I think that's why there's such a mistrust.
The mistrust is from very real abuses by the research community. And so core to Care Access is going to these communities that have been hard to reach.
I believe the Tuskegee experiment was able to happen because people trusted research enough then.
Being part of research as a participant in the past kind of had a bad
image research did.
Too often, we've seen healthcare that doesn't work in our communities.
Whenever we hear words like research, we freeze. What research is telling you is what you can get in 10 years.
I don't like giving my blood, but I was able to give my blood to Care Access because I knew I would be a steward of the research long-term of where that was going.
What makes this a good partnership, you guys have come here and you've listened. You've listened to a lot of people. You've asked questions, and you're not just a flash in the pan. This is going to be a commitment that's going to last by committing on a number of different levels, including community development.
The partnership with Care Access has been the step that we needed.
With Care Access combining with the Forest School, it's changing history. It's changing the way that Black people have access to change their health.
Harris and Terrace and I met about just 8 months ago. But what we saw was a team with a mission that had an overlap with the mission of Care Access.
Our goal would be to create a new forest patch or a space where we can extend the garden and go across the street.
Hopefully through this process together, we will help somebody.
What is Care Access really all about? We want to help communities learn about research, and we want to help make research accessible.
My mother-in-law had Alzheimer's first, and because of her and her advancement, I noticed it in my mother.
We have heart disease, we have cancer. My father had a heart attack at the age of 47.
You know, with COPD, it's not getting the air in, it's getting it out. I might have to use the rescue inhaler 3 or 4 times to clean off one of his feet. Fortunately, I found the study.
When Care Access came to our little rural part of the world, I went and signed up for the heart study that I am part of.
I really felt like I was doing as much for me as it was for somebody else. I'm a trailblazer. My study is called Alzheimer's Trailblazer.
I have 3 adult children. I hope that by the time they have kids, we have made a lot of progress on heart issues.
But I am making a difference, and it makes me feel good.
The universe speaks to you. It talks to you to live the best life that you can and what you need to do to help others.
Mom passed away from cancer, ovarian cancer. If we had something like this when she was diagnosed, God knows, we just got to keep going and just keep educating.
In my eyes, you're my hero. You're stepping up to the plate to do something that a lot of people won't do.
The souls that have come together for the singular purpose of helping somebody else.
I'm proud of it. My husband's proud of me. My daughter's proud of me for being involved in this.
I'm being part of history here. Like, my name is part of history now with Care Access.
Creating access for communities all over the country, all over the world. That's how we're going to make health better for the future.